Thanks for joining us today. We're going to be talking about autism, and the last webinar that we did about autism was really about what autism is. And today we're going to talk about what it is not. So this is called Dispelling the Myths, Understanding Autism. And this webinar is brought to you by MedPsych. Here's a little bit about us. We have special expertise in working with children and adolescents, but we do see adults as well. We provide psychiatry services, psychotherapy, neuropsychological testing, diagnostic testing, and treatment for autism and ADHD. And we're located in New Jersey, in Ramsey, Old Tappan, and Montclair, but we also provide virtual and telehealth services to all of New Jersey and New York. So I wanted to talk about the misconceptions about autism today. I think this is very important because we need to address misconceptions in order to promote understanding, to reduce discrimination, provide accurate support, and foster inclusivity for these individuals. So we'll get right into it. The first misconception that I certainly have heard is that autism can be cured. And there are a variety of different services and therapeutic modalities and things that are out there. I do think it's important for us to recognize, however, that it is not a disease that can be cured. It is a neurodevelopmental condition. It's present from birth, and it persists throughout the person's life. These therapies and interventions that exist out there, the best ones are to help that person develop skills and strategies to improve their quality of life. But beware of anything that claims to cure autism. Certainly, individuals can gain skills and develop further and eventually have very functional, successful lives. And we'll talk a little bit more about that later. Let's move to our next one. So it is a misconception that autism is a single well-defined condition. Autism, which is also called autism spectrum disorder, it is a spectrum for a reason. It really encompasses a wide range of symptoms, abilities, and characteristics. Each individual is unique and their experiences can vary significantly. And I think it's very important for us to recognize that everyone has different abilities, different strengths, and also different weaknesses. And the same applies here. But because this spectrum encompasses so many different characteristics, there really are not two people that are the same with this diagnosis. And as a result of this, you will see that sometimes the lesser understood presentations often get missed. Our next myth is that all or most autistic individuals are nonverbal or have intellectual disabilities. This just goes to what I was just saying about how many have different speech and intellectual challenges or other areas that they find difficulty in their life. However, some are highly intelligent and have exceptional abilities in specific areas. But there are also quite a few, and I think this is the majority of what I see in practice and when I do assessments, is that most actually have average intelligence. They have abilities that we assume that they don't have. It varies so widely because it's such a wide spectrum. Regarding verbal abilities, we'll talk a little bit more about this later too, but Some may be nonverbal or non-speaking, which are different terms that have different meanings. But some may have exceptional linguistic abilities. Some may have talked very early. Some may use a very extensive vocabulary. And the development of language in autism can occur in a variety of different ways when they are learning to speak. So it's quite varied, and we can't assume that all autistic individuals have difficulty speaking or that they have intellectual disabilities. Intellectual disability is actually its own diagnosis, and it is one of the areas that is important to assess when determining if someone has a diagnosis of autism. However, that is because intellectual disabilities can co-occur, and but that individual may or may not have that problem. Now, this is probably one of the biggest myths that are out there, that autistic people lack empathy. Very, very common misconception, and I hear it a lot. My child definitely has empathy. I see it. They have too much empathy. And I think it's important for us to remember that this is not part of the criteria, and it's not the case for every autistic individual. Many of them will have deep emotions and very deep empathy, and they may struggle, though, with expressing their feelings. And I think this is where this myth comes from. They may not be able to express that they feel for the other person, or they may do so in ways that are not typical. And because we typically look at someone's expression and behavior to determine if they are empathetic. So it's just important to remember that this is not a characteristic of all autistic individuals. Basically, it's just a difference in communication and not a lack of empathy. So I think we've all heard this one. There was a debate long ago about autism being caused by vaccines, and without going into that whole discussion, it is a fact that numerous scientific studies have debunked this. The original assumption originated from a fraudulent study, and that study, although it was published, it was discredited and it was retracted. And numerous studies have since disproven this belief. And as time goes on, there's so much research that's coming out that looks at what the causes of autism are. And it's actually believed now that the cause is very complex, and it involves a combination of genetic factors and environmental factors. There's a strong family history component, and we don't fully understand still what causes it. However, it seems likely that there's a genetic predisposition. So another myth is that autism is much more common in boys. There's much to say about this assumption. Historically, autism has been diagnosed much more frequently in boys than in girls, leading to that misconception that it primarily affects males. But now researchers believe that it's probably underdiagnosed in girls and women because they often exhibit different behavioral patterns and coping mechanisms. If you look back in history, the original description of the diagnosis, which occurred in various places across the world, was typically described in boys only. And as a result, many of the early assessment tools were based on the presentation in males. And much less is understood about the presentation in girls and women. We don't know the exact prevalence yet. It is still being researched. However, we do recognize now, and it's pretty well established in research, that girls and women have a much different presentation. A lot more of it is internal than external at times. And they may not display the typical well-defined characteristics that many boys display. There's also the issue of masking. It seems that girls and women are much more social and have ability to mask their symptoms. So this may contribute to the difficulty in getting a diagnosis. If they have been masking their autism all through their life, it may not be picked up in a formal evaluation. So there's still much more to learn about this. But there are a few experts out there who have dedicated their professional careers to looking at this topic. And, as a result, we're learning more as time goes on. Another myth is that this is a childhood disorder that children outgrow. This kind of goes along with the previous assumption that it can be cured. However, it's today recognized as a lifelong condition. And we do have early intervention. We do have quite a few treatment modalities available to help to help them develop essential skills. They still may continue to have challenges throughout their lives in some form. So rather than focusing on outgrowing or curing, I think it's much more important that we focus on support and accommodations, because the proper support, the proper accommodations allows people with autism to live very fulfilling and productive lives as adults, or to possibly reach their maximum abilities. And that's definitely what we want. So this is a myth that I hear quite a bit in practice as well, that, my child can't have autism because they have a lot of friends, and and I would only think that if they were socially isolated. And so it is an assumption out there that autistic individuals prefer to be left alone and to be not interacting socially, and that they're very isolative. However, we have learned over time, and especially through the reports of adults who have grown up understanding this about themselves and their diagnosis, we find that it's not true at all. They just struggle with the social interactions, but really many seek social connection just as much as the rest of us. And they may really enjoy spending time with others. It may be difficult for them for various reasons, or they may be limited in how much socialization they want to have, but it's not a general criteria of the diagnosis that they are social, that they are isolated or not social. And in fact, social isolation can actually cause a number of other problems: depression, anxiety, not meeting their full potential, etc. In reality, the social isolation piece is believed to result from be more of an issue of difficulties with communication and maybe even sensory sensitivities. It's just not a universal characteristic of autism. Of course, there may be language difficulties. There may be, as far as sensory sensitivities, I think it's important to remember that maybe the environment is too loud for them. Maybe they would love to socialize, but being around a group of people is overwhelming. And so we just have to understand how they best prefer to socialize. So this myth kind of touches on some of the guilt that sometimes parents have when they find out that their child has this diagnosis. And I find it important to address when it comes up, because autism is not caused by poor parenting or neglect. And I certainly work with families who find that other family members are blaming them. It's not caused by poor parenting. It's not caused by neglect. It is its own condition with a strong genetic component, as we discussed before. Parenting styles may need to be different, and parents whose children have autism may display different parenting techniques and strategies because they're figuring out what works the best. But this is something that you can't induce in your child, and as a result, there's no reason to feel guilty that you've done something wrong, or even that you've missed it, or you've missed a window to help your child. It's just simply not true. So there is a bit of a misconception out there that, and mostly because of our media, some movies that are out there, that autism, to have autism, you have to have a special talent or a savant ability, Rain Man-esque type skills or talents. Some do, though, some have exceptional skills or talents. Some are great mathematicians, or incredible musicians or artists, and maybe those particular skills are really quite impressive compared to what others can do, and that's great, but not all possess these abilities. So the lack of a special talent or a savant ability does not rule out the diagnosis. It's just a very limited portrayal of autism, just one particular spot on the spectrum, per se. Now, another myth that I hear is that autistic individuals do not understand sarcasm. And this is a tough one, because certainly some of our assessment tools that we use when we're trying to establish diagnosis do ask about their ability to understand sarcasm. So I think this myth is still pervasive throughout a lot of professional careers and training. Like anyone else, they really vary in their ability to understand and interpret sarcasm. The ability to take a joke or make jokes does not rule out autism. And in fact, I have seen quite a few kids who have been diagnosed meet full criteria for the diagnosis, and they are jokesters, and they come up with all kinds of funny things and enjoy making people laugh. So it is that's one thing that is definitely not universal. Sometimes maybe the more subtle sarcasm, might be missed. You may not understand when someone is being sarcastic, not saying what they mean. That, sometimes that's the case too. But again, like we said earlier, some have great linguistic abilities and have great receptive language skills, and they understand some of the sarcasm that's thrown out there, and can determine that it's sarcasm by the context of the situation. So it's not a universal thing, but certainly some do have difficulty with this, and that results from challenges that they have in social communication and understanding the non-literal language, while others have, no difficulty at all. Like I mentioned before, the ability to understand sarcasm can really depend on things like level of functioning, cognitive abilities, exposure to sarcasm in their environment. I think that this is important to ask if any of you are trying to tease this out, that is this child exposed to sarcasm? They may come from a home where there is no sarcasm, there is no joking, there's, it is literal language all the time. And they just may not have had exposure to it. So they go into social situations and it's difficult to interpret what's going on. So it definitely needs to be taken into consideration, and also what culture they came from, because, culturally speaking, sarcasm can vary quite a bit. Similar to the discussion about empathy, as we mentioned earlier, I get this quite a bit, that my child doesn't understand others' emotions, and they don't care about others. They just want what they want for themselves. And that's just not a universal characteristic. Autistic individuals can understand and perceive others' emotions. They just may do so in ways that are different, or maybe sometimes they get it and sometimes they don't get it. It just may vary compared to neurotypical individuals. But autistic individuals have, again, a wide range of abilities when it comes to recognizing and understanding emotions in others. Some autistic individuals may have challenges with recognizing and interpreting facial expressions, tone of voice, and body language, which are common cues for understanding emotions in neurotypical individuals. Some of what contributes to this is that they may struggle with the nuances of social interaction. So they may be a little bit more literal, or they may not understand where that person is going with what they're saying. And so there can be some misinterpretation. Doesn't necessarily mean that they don't understand that the other person is upset or sad or angry at them. However, that can occur sometimes. And there are some who, on the other end, actually really pick up on these subtle emotional cues quite a bit, that they have a really great ability of doing this. Of course, I had to address this one. Hand flapping is a universal trait. This is, again, one of those questions that still today are part of some of the assessments that I see. Now, where does this come from? This comes from the part of the criteria for autism that there are repetitive behaviors. And this is just one that is very visible to an outsider. So it gets associated with autism very frequently. Certainly, some people do display this, but it is not universal across the board. They may have other repetitive behaviors or self-stimulatory behaviors or stimming. They may rock, they may spin. Again, these are very common, obvious displays of these repetitive behaviors, but they are very commonly assumed to be universal. Oh, my child didn't have echolalia, they can't be autistic. Or, he doesn't rock, he doesn't spin, he doesn't flap his hands, he's not autistic. These are just not used by everyone. There could be completely different repetitive types of behaviors that they do. They may be very subtle and not observed to others. Some of the more subtle of these repetitive behaviors that I've seen could be headphones on, watching the same YouTube video or show on Netflix again and again. No one knows because they can't hear it. It could be that they want to have the same food for breakfast every single day and can't deviate from it. But it just looks like a personal preference. There are so many subtle repetitive behaviors, and just because we don't see them on the outside doesn't mean that person is not autistic. Another big myth is that they can't develop relationships. And I think one of the things that parents get most concerned about when we suspect autism, when we diagnose autism, is that, oh no, my child will not be able to develop relationships, friendships, get married, have kids, and they'll be isolated. This is not a universal trait. And so some certainly do form deep and meaningful relationships with others. Some have long-term stable relationships, get married, have best friends. It's not a definite that relationships are difficult. However, these relationships may vary quite a bit depending on what they look like, what activities they share together, how they communicate with each other. They may be based on specific abilities or specific challenges that they share. But I do think it's important for us to recognize what are the barriers to developing these relationships. Certainly the difficulties they have in social communication, how they interact with each other, how they relate to people. Sensory sensitivities, again, can get in the way. If you don't like the pressure sensation of someone touching you, you're not going to want hugs. And we all know that physical affection is often a part of relationships. So support, understanding, and accommodations are really the key to overcoming these obstacles and helping develop beneficial relationships. Now, this is an assumption that a little bit different than the above. This is an assumption that I don't hear per se, but I have seen occur, is the assumption that maybe a parent or a teacher or someone is making an assumption that this minimally verbal or nonverbal child doesn't understand what the adult is saying. Autistic individuals definitely have differences in communication, understanding social nuances, understanding nonverbal cues. These are all possible difficulties that they may have. And understanding context. We use a lot of context to convey our meaning in what we say. And sometimes that context is confusing or lost on them. So despite all of that, that may all cause some difficulty in understanding fully, but it doesn't always mean that they don't understand what others mean or are saying. And as a result, this can be hurtful. It can cause frustration. It can actually create barriers to that person communicating their needs, because maybe they want to communicate in a different way, but that individual is just not listening to the type of communication that the autistic individual is using. So it could be that they understand everything completely, but they just can't verbalize the understanding. And so the assumption is that they don't understand anything at all. But I think it's really important to know that there are over 10 areas of the brain that are responsible for speech, language development, and communication. And those are all very different processes and pathways to communicating verbally. Has nothing to do with the understanding. So my best advice on this one is to presume confidence and work to find the communication style that works the best. Just be careful that you're not saying something in a way that would put them down or be hurtful or anything like that. This is another quote that I have heard, and it again kind of goes along with quite a few of the other sides that we have, but I can't emphasize this enough. I have seen children who have been denied the diagnosis by a 15-minute evaluation in which the clinician said, he's too social to have autism. Just because they appear social in the context of a formal interaction does not rule out autism. And in fact, there are a wide variety of social skills and different ways of engaging socially that these individuals can have. Their social behaviors vary widely. Some may have strong desire for social interaction, as we discussed before. Some may struggle a lot with understanding that social interaction, have trouble picking up social cues, things like that. But the presence of strong social skills doesn't rule out an autism diagnosis, especially if they have been taught explicitly how to have social interactions. Other characteristics and challenges are equally important to consider. Autism is definitely not, again, I can't say it enough, it's not determined by the individual's level of sociability. And if we make this assumption, it perpetuates the misconception and it does cause harm in the end. Okay, so we got through quite a few misconceptions. First, if you have questions, go ahead and put them in the Q&A box. I left quite a bit of time for us to talk through some of those things. And the questions are only seen by me. They're not seen by the audience, so feel free to say whatever you want to say. And while I'm waiting for some questions to come in, I see there's one there already. I do want to say this is not an exhaustive list of misconceptions. In every patient that I see, in every autism evaluation that I do, I feel like I'm constantly addressing misconceptions. It is really concerning to me how many are out there. And we need to do a better job of understanding, learning, educating each other about what autism actually is and what it looks like. This list is quite general. There are different misconceptions in children versus adults, in boys versus girls, men versus women. Very many different misconceptions are out there. I think it's worth taking a look at the language we use, the things that we say, and taking a step back and just assessing whether we're using any of these in our life. All right, I'll start with some Q&A. All right, so the first question that I have is about autism. Can autism change? Do the characteristics of autism change over time, adolescence, and what is the effectiveness of ABA therapy? Quite a few questions there. The characteristics of autism absolutely do change over time. Now, we have to keep in mind that when a child is diagnosed, and I say child being diagnosed because this is the typical age group that's diagnosed. Now, I see a lot of adults being diagnosed now, which is fantastic. Getting the answers that they need for themselves that's exactly what we want to happen. But if we're looking at a child 4 or 5 years old, just getting a diagnosis for the first time, and you follow that child, if you did nothing at all, when they're 12, when they're 15, when they're 18, you're going to have very different presentation. And a lot of that has to do with brain development. That brain is developing exponentially over time. And we are seeing so many different things change as the brain develops. When you throw in there speech therapy, occupational therapy, ABA therapy, whatever it is, to get some improvement in some things that are difficult for that individual, of course, you will see. That's the whole goal of all these therapeutics, is to get some improvement and help that individual. So it will look very different. And that's why when we're doing an assessment, we look back over time. And the DSM-5 criteria actually say that they don't have to meet all these characteristics today when you're evaluating them, just at some point in time. So if it's an older teenager that's being assessed, we actually have to go back and consider their toddlerhood, their early elementary years, to look for what may meet the criteria. So that's the long answer for yes, it does change over time. As for the effectiveness of ABA, I can't really comment on that because I'm not an ABA therapist. It's I think it's you could probably find that, but to me that question would depend a lot on what do you consider effective? What are the goals of that treatment that you're trying to achieve? And then look at, okay, well, if our goal is to reduce this undesirable behavior, how effective is ABA for that? Well, that's a specific question you may be able to find the answer to. But if the goal is to improve upon speech, well, it's going to be less effective, maybe more effective with a speech therapist. I don't know. It depends on what you're looking at. The next question is, can stem cells be used to help Asperger's if you are in your 30s? I am not aware of stem cell therapy being effective for anybody in their 30s. And just for those who are unaware, the Asperger's diagnosis was a former description of a different, it used to be considered a different diagnosis than autism. In the latest criteria upgrade, they said it is part of autism, and therefore it's the autism spectrum. And so people who met criteria for Asperger's back then, they now meet criteria for autism. So that's what that means if you're unaware. But as far as stem cell therapy, as much as I know about it, is still very early in research, looking at what could be done with stem cell therapy. So I'm definitely not aware of any regular use of this in clinical practice. Do I know how many people have been diagnosed around the world? I don't know exactly, but the statistics vary quite a bit. And this kind of comes back to the fact that a lot has changed over the years, because statistics lag by quite a few years. And with the latest change to the criteria, so many more people are coming under the umbrella to meet criteria. Used to be every 1 in 40 some, and now it's every 1 in 30 some. And we have a big shift towards more people being diagnosed over time. That doesn't even include what I had said earlier about girls and women and their presentation. So if you talk to the experts, and what I have heard from the experts who talk on this topic is that it is extremely unknown and probably extremely underdiagnosed. So those numbers, the numbers that exist are thought to be inaccurate. And the other question that I have here is, do you know of a list of proper lingo that should be used when talking to and about autism? What to say, like instead of this term, use that term. I think this is a really great question. You will see that even though I went through and edited this presentation a few times, still sometimes I changed the way the terminology that I used about autism. Autism as a general term versus autism spectrum disorder. I think that's okay if you're talking about clinical diagnosis. It's proper to use autism spectrum disorder. Using the language autistic versus person with autism is a big debate lately. And, I think you really have to go by what that person prefers to be called. For some, they feel, and this comes from discussions from older autistic adults who have said, we want to be called autistic because it's part of who we are. And that's, how we identify ourselves. And if the individual feels that way, you should respect their desire to be called autistic rather than a person with autism. Now, in medicine, I can tell you that we generally are taught to use person first language, where we say person with autism, and that's to separate the person from their diagnosis. So big debate about that. I would ask who you're speaking to, what they prefer to be called, if you need to change that terminology. Other proper lingo. I can't think of any others at the moment, but if you've heard some you're questioning, just go ahead and put them in the chat and I will let you know what I think. Okay, here's one that's specific to a child, so I'm going to read it first. So this individual is asking about their child and having difficulty in school. I kind of feel like this is a topic I should cover next with autism, because this is a conversation that I have with my patients that I see for psychiatry day in and day out. I even had this discussion today. Is there a better option than public school, like a smaller setting or homeschool or whatever? It is so highly individual what the best thing is. The best thing for some children is to be in public school. The best thing for other children is to be in private school. Some need to be in a 2E school. Maybe they have an autism diagnosis, but they also have extremely high intelligence, and they don't fit in any specific environment, and they go to a 2E school instead, twice exceptional. So it really depends on the needs. My best advice is to work with your school district first to see if you can refine the goals. So, they make an initial assessment, they give goals of their education, and they put into place whatever accommodations they think will help them get there. And sometimes that doesn't work. And so you need to go back to the drawing board. If you don't agree with an IEP or the accommodations or the setting, have communication. Put everything that you see that you're concerned about into writing and go back to the drawing board with the team. They should know you by name and they should know what you're looking for. And if you're not sure, my best advice is to get an advocate to help you determine whether what the school is doing is right for you. And I do know there are quite a few advocates who operate virtually, and but they tend to be state specific because different states have different legal requirements. Oh, such great questions. Because I just talked on this, I'll cover the 2E school. 2E is twice exceptional. Now, I don't know where all of you are from. In New Jersey, I think there were a few. New York City, I'm aware of some. That there are specific private schools for kids who are 2E or twice exceptional. And twice exceptional means that they are gifted, they have high intelligence, but they also have a diagnosis like ADHD or autism. And these schools are few and far between. So if that is something you think is relevant for your child, I think it's worth looking into. I have seen some kids do extremely poorly in all other school settings, but respond very well to this type of setting. And the other question on schools that I see is that, do private schools follow the IEP? Yeah, this is really hard because the public schools do have a legal requirement to follow the IEP, develop it, and carry it out. And private schools sometimes will do it, but I'm not sure that they are held to the same legal obligation to follow it. So it depends quite a bit. And I think it depends a bit on your state as well. On that, I think the reason I brought up private schools before is because the private school that I'm talking about would be something like a 2E school that's very specific to the needs of that child. But I think you're right. Another great question is, are there any tips to help parents distinguish social anxiety from autism? Some parents may say my child is socially awkward, or they only look at their phone for hours, and should I have them evaluated for autism? I would want to really dig in and find out what the concern is. And what is the way that I would approach this is, if that parent was sitting in front of me, I would say, well, what makes you concerned? What does that look like? And understand that question it as thoroughly as possible to really determine, is there an abnormal pattern here? And understand that child's internal experience. There are some questionnaires and things that exist out there to look at social anxiety specifically. But you're right, there's quite a bit of overlap. And kids who are socially anxious, which means that they have trouble in social situations, they may have trouble in groups, they may not be able to speak in front of groups, they may worry about what people think about them or how they look to others, or they may think about things that they said and obsess about that or perseverate on that. And so, to me, I think it takes a skilled clinician to look at all these different effects and figure it out, whether there's social anxiety or not. But I can tell you there's a pretty high co-occurrence for a child that has autism to also have social anxiety because of the difficulties, that they have socially. But I would also look for other clues. The more you learn about autism and the criteria, there's more than just social difficulty, right? There are communication difficulties. There are repetitive behaviors. There are restricted interests. There's the need for things to be the same way. And if I, took a bit of a history and I picked up on some of those things, I would say for sure have them, have them assessed. So, if they're assessed and they don't meet the criteria, then at least you've ruled that out. But if there's enough of a concern, definitely. One possibility is maybe that child needs to be treated for social anxiety or have therapy first. And then you get more information as to what they experience. Are there any new books that you would recommend in the field of autism. Oh, the best book. My absolute favorite is Neurotribes. Neurotribes is a New York Times bestseller kind of thing, and Neurotribes covers the whole history. I think if you were someone who's like looking to understand, not clinically about autism, but the background, how it came to be recognized as a diagnosis, things that occur socially that lead to diagnosis or prevent someone from getting diagnosis. The Neurotribes book is amazing, really long, but it covers, it gives you such a background to build upon that I think that's the book that I would recommend to anybody. But if you are looking to understand more about it clinically, Donna Henderson and a few others put together a book not too long ago. I think it came out this year, about autism, and just started getting into that one, but it's about all the features and everything. I'm so bad at remembering specific names, but look for Donna Henderson and her book. It's on Amazon, and that's the new one I'd recommend. Are there any autism podcasts you would recommend? There are so many. What I do, I love podcasts. I just go in and I look for, I search autism and whatever the other thing is that I want to know. If I'm looking for information about sensory sensitivities, I'll put in autism and sensory, and I'm looking for things that that are by professionals specifically. I'll give you a good one that I came across recently. Look for professionals who like do work in this space, and see if I can find it really quick. The one I listened to most recently. I personally love Donna Henderson, so I search her specifically, and if I find something that she's on, I listen to it. Yeah, I can't find it right now. There is one that I did come across that they interview clinicians specifically, and the email they interview speech therapists and occupational therapists, and I think that's the key, is to look for information by professionals who work with these individuals. So just so that you get the most in-depth and up-to-date information. All right, any other questions? I think I got through them all. Okay. Oh, okay, you're welcome. This webinar will be saved, and you'll be receiving an email with the recording, and it'll be on our YouTube channel as well. So if you have any questions specifically for us, at the bottom here is our contact information. You can email, and if you have a question specifically for me, you can send it to that email and I will get back to you. If you're interested in any of our services, you still can email that email, but you could also go to our website, and I'm happy to hear from any of you. Also, if you have any suggestions for future webinars, that would be great. I think the school question is a good one. We may touch on that in the future, but we're open to ideas. All right. Thank you all for joining. Have a great day.